I can see where is the gap. There is gap, how we can approach these educators that we want them to be perfect. The school is a closed box, and we are outside and they are inside. And to get inside the school is not easy. They are very busy.
Thank you so much, Dr. Haneesha. That was wonderful. And I think you highlighted the importance of early childhood educators when it comes to kind of the role of everything we do in developmental and behavioral pediatrics, and how we really need to focus on early childhood educators. And you're totally right, because whenever we do give talks, when we go to schools and we talk about our services, you immediately find teachers who are saying kind of, what behavioral strategies should we use? Help us, teach us. I think that's super, super important. So thank you for highlighting that. And I completely agree with you, most of your thoughts in the talk. So thank you for giving that. I really appreciate it. I think there's one question that Haneesha kind of went over, which is what is the incidence of neurodevelopmental diversity in the UAE region? Because I don't feel like we have the strongest statistics in the area. Haneesha, I don't know if you agree.
Yeah, I think that's again another area which we can look into to understand. I think especially with the current population and the current generation, where we are seeing such a huge rise in neurodiverse populations, so it would be one of the great studies to try and understand what's happening in our region as well. Yeah, so I think I'm not aware of any data which exactly gives us an incidence, but worldwide, the incidence is kind of moving towards 25 to 30%. So I would not be able to answer to specifically UAE. That's something we'd be great to look into.
I will say something. I've been working in mental health. I think pretty soon I'm going to get my board without going to school for it. But Dr. Dalal did not agree. But let me say this. I can see where is the gap. There is gap. Really, there is a gap how we can approach these educators that we want them to be perfect. The school is a closed box, and we are outside and they are inside. And to get inside the school is not easy. They are very busy. They are hectic work. They don't have a time to think about you or about your education or anything. Even you offer it to them, it's very hard. And there is miscommunication also from the higher up, where they, offer this kind of courses, offer this kind of education in a certain way. It seems to me like the school is left by themselves and the outside world is left by themselves. And we only wait until problem happen, and then the connection happen. There is no pre-education. There is no preparation for teachers. Many schools, they don't have what we call it inclusion person, or a psychological person, or a person who can deal with this kind of problem. They have semi-experience with what they do every day, and they develop it as such, and they try to understand their community. But I can see from Dr. Dalal, she visited a few schools that in my knowledge, people are so happy. The problem, how can you get these people to be there on the time when you have also time? So it's just a very challenging. I don't know. What will you say about that? How can we solve this?
I think what you brought out, Dr. Sulaiman, is so apt, because to find that, I mean, like you said, as healthcare professionals, we're really eager to teach them or help them, and they are really eager to learn, but to find that time either in-house in the school or, to cater to that is difficult. I think possibly one of these could be having these upskilling training programs, maybe, which we can, space out for them, which could be a convenient time for both us as well as them to attend, which gives them an opportunity, let's say weekends or, certain periods of time over a length in the format of many sessions, where they can actually have these upskills, and it can be run in batches so that people can see what best suits them and they can attend to these training programs.
I just want to add to that I feel like I agree with Dr. Haneesha, and I feel like maybe the summertime is probably a good time to do most of that training, because schools are out And so there's time to train those teachers. However, I do want to highlight the importance of this being like a multidisciplinary team approach. So it's not just the speech therapist going and helping or OT. It's also the ABA, behavioral therapist, the developmental behavioral pediatrician who can check in every now and then, the psychologist, because I did get a lot of questions from the teachers when I did visit the schools about kind of what should we do? What can we do? So in books and literature as developmental pediatricians and our experience in the clinic, it's great. We know what the behaviors look like, but the people that are better at approaching this are the ABA therapists and the behavioral therapists and the psychologists who do behavioral modification therapies. I feel like we need to be a team that works with these teachers.
Yes, yes. So I think some of these, again, some of the therapists do go into schools and the kind of in-person, like the peer coaching we were talking about, they're like, okay, this is the behavior, this is how I'm handling, this is something which you can try when we are not around, because they may be there just for an hour and the rest of the time the teacher is left alone to handle the child in the classroom. So I think even such small integrative efforts will go a long way for them to, help upskill themselves in these strategies.
Okay. What I'm saying is there is a barrier between the professional outside and the school inside. You cannot find the teachers. They cannot find you. How can you teach somebody you don't know where they are? You don't know a way to communicate with them. If you send to the school, they will not be able to have a chance to talk with you and sit with you. They don't have time. And then summertime, you don't know who they are. It's by a chance and by a lot of effort, we are able to go to visit one school here or there. But there is no way systemically we can have a combination between the mental health professionals outside and the school inside and build a kind of a working relationship between both sides. Is that what I'm seeing or I'm wrong?
We do see that there is a very big barrier. I feel like coming from the US, from my training in the US, there definitely is a bigger barrier here in the UAE than there is in the US. There's a lot more communication between schools and professionals in the US, but I feel like we are slowly getting there. I will say I do have quite a bit of teachers that do reach out personally with the permission from the families to talk about certain behaviors and have us kind of troubleshoot what we can do about certain behaviors that they're seeing within the classroom setting. And then I'll discuss that with the behavioral therapist. If need be, then we can find a time for all of us to discuss. But I totally agree with you that there still is that the barrier that's still there. I'm not too sure about Dubai, Haneesha, if you want to touch upon Dubai, but that's what I'm seeing in Abu Dhabi at least.
Yeah, I think it's quite similar. Even here, we do see a lot of teachers who are reaching out along with parents, or they refer the parents saying that this is the kind of behaviors we're targeting, we're seeing in the school. Can you get somebody to help us understand what's happening and give us a lot more strategies on how do we deal with the child. So I think that's something which we are seeing a lot more often now, and parents are also in the process of understanding that it has to be interdisciplinary. It cannot be everybody is working, the teacher is doing something. Let's say if there is a therapist with a child, they are doing something and we are doing something. They are understanding everybody has to be on the same boat, have to communicate with each other and try to work in the same page.
I think there was a comment in the group from somebody that said, along with professional skill development, if educators are trained to overcome compassion fatigue would be great. We really need support here. We need counselors to trainers who are directly attached with children and their family. For sure, there's definitely that. There's a missing link here that we're trying to get to slowly, just like Dr. Sulaiman was saying, there's a barrier, there's a missing link. But I absolutely agree with this comment. I think we do need to provide as much support as possible. We always say it takes an army. So that's what we're kind of trying to do one bit at a time. We're getting there, but I think it's going to take a little bit longer than we hope for.
There is another question, Dr. Dalal. Do you see it in the question and answer?
Yeah, go ahead, Haneesha. I can't see it for some reason.
So we have Ms. Bhavna Gupta, who says very relevant topic. Thank you all for bringing this up. There should be a link between the education system and health system. I just want to say that I feel that efforts should be made by us as pediatricians to emphasize and advocate for all children particularly neurodiverse, and by promoting the need for early intervention and hence changes in the education system to fulfill it. Absolutely right. So I think that's where also through the talk, I brought it up that they are such an important link, because in the first 5 years, the children are exposed either to the caregivers or these early educators, right? So by helping them understand what neurodiversity is, or what kind of signs and symptoms are displayed, how do you pick them up, when do you refer them, how do you help the families to understand the need for further support, I think that's an incredible potential they have to be able to pick up children earlier and help us utilize the neuroplastic period in actually helping the children reach their potential.
Yes, I agree. And I think more and more nurseries are jumping on board with this. I am getting a lot of parents that are referred to us through the nursery school teachers. So early educators are actually key to getting the kids evaluated early. So we always stress the importance of early intervention in our work, because we couldn't do what we do if there wasn't proper early intervention. That's why it's key to strengthen that. And I am seeing a lot more of that through nurseries. So emphasizing the importance of early childhood education and quality nurseries, quality daycares to get kids referred earlier. So we are seeing a lot more of that, which is impressive. Hopefully more nurseries will jump on board with that.
True. And also, like you said, I think nurseries now also have an in-house behavioral analyst, or they have an in-house therapist on board who can cater to the challenging population or the neurodiverse population and support them in the day-to-day. I think it's more like mini upskilling of their skills on a daily basis, child-based, based on the IEP plan that's happening, which is again a very positive thing to see, that there's some bit of link that is establishing between the healthcare and educational system already.
Dr. Dalal, anything else?
Yeah, no, I don't see any more questions or comments. So I think we're ready to wrap up, but I just wanted to thank Dr. Haneesha once again. I think you did a wonderful job at that. I think it's a really important topic to talk about as general pediatricians, as educators, developmental pediatric cardiologists as well, so my boss doesn't get mad, for everybody just to be on board with that. So thank you, Dr. Haneesha, again, for your time and your efforts.
Thank you so much. It's been an absolute pleasure. And thank you, Dr. Sulaiman, for picking this article for us. Actually, I was really thrilled and amazed when I read this, and I'm like, wow, I'm actually happy that you're reading this as a pediatric cardiologist. So that's like really nice.
I just want to ask the audience, if anyone, if you like any specific topic that you like to us to present in the very near lecture, the next lecture, please send that suggestion on the group and we will consider it. Another very nice announcement that I would like to say, we will have our first course preparation for a psychology exam in UAE for DHA, MOH, and DOH. Pretty soon, it will be about a full month, 2 hours a day. Dr. Dalal is one of the people who's going to be participating in it. It's going to be a good for people who are planning to take the exam in the near future. It will be also a good review for student in master degree as well as in psychology college. And we will learn more, and we will send you more information in the near future. Thank you very much.
Thank you.
Have a good day, guys.